So welcome guys. Here we are with another star of our DBMCI, and he has secured rank 803 in his in this recent INICET November 2023. And yes, we are with Dr. Siddhartha Taneja, uh,
Thank you so much, sir. Thank you so
proud
much.
student of DBMCI. And yes, on the behalf of whole DBMCI family, we all are very proud of you, and we want to congratulate you for your awesome success. So your
Thank you so
awesome
much.
journey of preparation is going to motivate aspirants who are going to give upcoming exams. So please guide your friends and peers.
Sir, I would like to say that what I have learned in these 3 or 4 months of preparation is you have to begin early. There is no, you cannot deny the fact that you always have to begin early because competition is getting so tough these days. And so I'd say during your internship, most people let it go to waste, the internship period. That is very necessary. At least you give one read of the entire syllabus during the internship,
Yes, yes.
and that plays a very important role. We didn't, me as a whole, like our whole batch, could not, due to COVID, our internship started late. So we had to give the first NEET and even the first INICET in the May one in between our internship. So we did not really get to complete the course back then. So it was just a trial attempt. But after your internship, uh, if you have read once the entire course, then 3 months is basically revision and basically consolidating your notes. And eGurukul has provided such a good platform to revise this consolidated material so frequently. I would like to thank Manjeet sir especially, who introduced me to eGurukul in my college, and like teachers like Ashwini sir in anatomy, his PDFs are still like go-to. Last minute revision PDFs are still in my phone, and I totally use that for anatomy, pharmacology, Smiley ma'am's biochemistry, her videos, Saurabh sir's dermatology, all. I don't think I could have scored such a rank in such a small amount of time if not for such concise material which I got through eGurukul app.
Okay. So you are from SRMS Bareilly, correct?
Yes, sir.
So this is like a motivation for all the students who are doing their MBBS from private medical colleges. Never have that downgrading attitude that I will not be able to complete. See,
Not at all, sir.
here is the prime example. You are the prime example, and I know many students who have done wonders in many exams, be it a government college, be it a private college. All depends on you, whether you start early or not. And yes, your journey with eGurukul will be secured, and you will have your belief is going to give you a very good rank, given the fact that you work accordingly. Like Siddharth has actually worked for his dream, for his success. Yes.
Yes, sir, definitely. Now, I don't think in today's time the private and government thing matters that much. It is the circumstances were different back then, and now it is different. And it all comes down to how clear your concepts are.
Okay.
And the books and material are same everywhere, but it all comes down to the last duration of preparation. It is the same for the government students and as well as private students.
Yes.
So it really comes down to that.
So the time duration is same. Every day has 24 hours, and that is same for all
Yes, sir,
the
definitely.
students. To be
Yes, sir.
exact, all the students have got the same time, same energy, same cranial capacity. So yes, how you have secured a rank is based on your hard work, and yes, your motivation,
Yes, sir,
constant
definitely.
motivation, discipline. You should be disciplined
Yes, sir.
for the journey of preparation. So like coming to that fact which every student faces कि सर तैयारी तो कर रहे हैं बीच में अचानक से एंजाइटी आ जाती है. I go into anxiety, I go into depression, and I'm not able to come out from that. So was there any time where you felt the same, and how you managed to overcome that?
Definitely, sir, such moments, because it is like a marathon, the preparation, both a marathon and a sprint, I'll say. So in such kind of journeys and such vast syllabus we have to cover, there definitely comes, I would say not one, but multiple times that one faces, depression and anxiety, and one does not have faith. And
Faith
so,
on
sir,
yourself is like
on
shaky
yourself.
at times.
Yes,
Yes.
sir, it's shaky. You might never know what might happen. And so, sir, during those times, I definitely faced. And what I did was, what I realized over time, that during that shaky period, you should not, you should give yourself a break for certain amount of time, because you're not really able to focus.
Hmm.
What you're reading, you're just looking at blank pages. It does not register in the brain. So, and I talked to many of my friends also, and it resonated with me that you should give yourself a little break.
Hmm.
Just leave, like, for take a break for a day or two,
Hmm.
and talk to people, talk to your peers, friends, faculty, especially eGurukul faculty, if you can, who are available to all of us everywhere. It certainly helps to calm and relieve the anxiety a bit. And after a day or two, I think I was able to study even better after
Actually,
taking that break.
actually brain को आराम चाहिए. Brain
Yes,
needs
sir.
break. So we should
बिल्कुल
give
sir.
that break to the brain, and we should give the brain that fuel in the form of positive
Yes, sir.
energy जो कि कम हो रहा
Yes,
है,
sir.
which is like deficient. तो उसको positive energy को fill करो by surrounding yourself with positive energy people like your friends, family members, faculties.
Yes, sir.
Yes, yes.
Definitely, sir.
So this is what every aspirant should do. कि ये human, this is natural human behavior. This
Yes,
is
sir.
not something which is happening with you all alone. All the students are on the same boat. सबके लाइफ में आता है. जो जितना जल्दी ओवरकम करता है, how you manage that in a quick time will save your time for your preparation. So जल्दी से बाहर
Yes, sir.
निकलना है उससे बस. Rather than thinking कि ये मेरे साथ हो रहा है, I am not able to do this. Everyone is on the same boat. Have that belief
Yes,
on yourself. अपने belief को ना कभी deviate नहीं कराना है कि that you cannot do this.
definitely, sir. Yes, sir.
Okay, so like your source of preparation was DBMCI's eGurukul notes and
Yes,
eGurukul
sir.
videos and all. Okay,
And sir, test and discussion, I would like to add.
test and discussion. Okay, which
Actually, that plays a lot of very important role. I
which
would say more
subjects
than the
helped
notes.
you the most in TNDs?
Sir, I would say pharmacology,
Hmm.
because especially for a central institute exam, pharmacology is asked, I think, one of the most asked subjects.
Yes, yes,
And so this time also around 2022, 25 questions came.
yes, yes.
If you compile pharmacology. So pharmacology, sir, definitely. And sir, pathology, anatomy, biochemistry, basically all the volatile subjects which
Volatile subjects.
medicos are afraid of. Yes,
Medical,
sir.
medical should be fearless.
Yeah.
eGurukul is there
Yes,
to
sir.
make all the medicals fearless, isn't it?
Yes, sir. Yes, sir. So these
Yes.
volatile subjects for sure. And then shorter ones like dermatology, forensics,
Hmm.
and uh, the biochemistry,
Hmm.
all these also, sir.
Okay. So while I am trying to gather your inputs, just guide the aspirants with final words कि कैसे preparation करना चाहिए and how you should move ahead with upcoming NEET PG exams on 3rd of March.
Sir, I would like to firstly thank eGurukul for providing me opportunity to connect to so many young aspirants like me, myself. And I would just tell them ki have faith. It is very much possible. People who have scored a rank of 50,000 in their attempts can easily score a rank of below 1,500 easily. So it
Hmm.
is not something impossible. It is
Hmm.
very much possible and within the grasp of your hand. You, first of all, you just need discipline,
Hmm.
motivation, and have faith in yourself that you can do it.
That
That
you
is the
can.
most important thing. Then comes the syllabus part.
Yes. Then
First is
comes the
this.
syllabus and then comes all other things.
Yes, sir. Yes, sir. It is
And
part and parcel of life.
yes.
Rest, all.
And how many revisions are actually needed? Like this is different for every student, but each
Yes, sir. I would, yeah. This is very variable, person to person. I would say if you're a slow reader, like I am a slow reader,
Hmm.
it took me 2.5 to 3 months just to complete one reading fully. But because I read slow, I retain more. That's what I've realized. So, I realized for me,
Hmm.
even one revision after that was fine. I could retain most of the things.
Hmm.
And the most important part is last 10 to 12 days, you have to read entire syllabus. You have to cover it.
Hmm.
Entire syllabus should pass by your eyes before the last 10 to 12 days. That is the most important thing what I would emphasize on. Whether you have done 15 revisions before that or just two revisions, For the last 12 days, you need to brush through the syllabus and let it pass slide by your eyes. It really gives you an edge. It really gives
reduces
you an edge,
that
especially for a central
extra
exam.
edge. Yes,
Yes,
yes.
sir. It retains the syllabus in your recent memory, I would say,
Okay.
immediate memory. So it really helps. The last 10 to 12 days are very crucial.
Very crucial.
And sir, otherwise, it does not. I think it is very variable. Some people revise 10 times also. Some
Hmm.
people just revise 2 to 3 times also.
Uh,
But
It
the
is
last
like a
10, 12
relative
days are
thing. It will
crucial.
vary from student to student.
Yes, sir. Yes, sir.
So, but you should revise to the point. The benchmark should be that you are able to
Definitely. So
recall your
precise
notes.
and concise.
You should be able to recall your notes.
Yes, sir. And more concise it is, sir, the better it is.
The better it is.
And sir, I would like to add here that for volatile subjects, what I did was the volatile topics like IPCs in forensics or the
Hmm,
basically entire pharmacology we
hmm,
have and anatomy, branches and arteries and
hmm,
tributaries of veins, all those things. And I also the milestones in pediatrics, for example. Those are very volatile topics. You'll basically we forget.
hmm,
So what I did was, and I'm not new to do this. Everybody, I think, does it nowadays. You make a separate copy
hmm.
from your notes only. You make a separate copy. You add these volatile topics. In that we call it the 20th copy. So
Things
that
which I forget frequently.
yes,
Uh-huh.
frequently, sir. It should be mixed, like all subjects together, only the volatile topics. It
Hmm,
should not be bulky. It should be hardly like 20-25 pages for everything.
hmm,
Very concise and crisp. And that, sir, I used to revise every third or fourth day. In the morning, when I used to get up, first
hmm,
thing was I used to flip those 20 pages every 3-4 days. So
hmm,
when I did that for like 40 to 45 days, a month or more, maybe 1.5 months,
hmm.
I was used to retain that. I was used to retain that information so that I could choose correct answer out of 4. That was my goal.
That
I
was.
did not want to memorize it, but I could make out the answer out of 4 options
And
from those
you
volatile
made all
topics.
the volatile things very strong by
Yes, sir.
frequent revision.
So
Yes.
because it is futile to just memorize those things, according to me, it should be read frequently. That's how you retain it
That's how
instead
you
of just
retain and
mugging it up.
recall it.
Yes, sir.
Exactly.
That really helped, I think, sir. That made a bit of a difference.
Chalo. It was nice having a discussion with you, Dr. Siddharth. And
Thank you so
yes,
much, sir.
on behalf of whole DBMCI family, I congratulate you on your grand success.
Thank
And
you, sir.
yes, the celebrations are not going to end in DBMCI. We have got
Definitely, sir.
good
Yes, sir.
results, very good results. So stay tuned to DBMCI official YouTube channel for more such inspiring interviews. Bye bye. Bye bye.
Thank you, sir. Thank you.